Welcome back to Face the Nation. We want to go now to Governor Asa Hutchinson of Arkansas, who is also the vice chair of the National Governors Association. He joins us from Little Rock. Good morning to you, Governor.
Good morning, Margaret. Good to be with you.
I'm glad we have you today to talk about the vaccine and distribution. I want to quickly ask you something, though, on the political front as a Republican. Nearly a quarter of Senate Republicans say they have concerns about voter integrity and plan on Wednesday to challenge Joe Biden's Electoral College win. This is, to be very clear, all but certain to fail in terms of changing the outcome of the election. But other Republican senators say this is destructive to do in the first place. Where do you stand?
Well, it's a process that they have the right to initiate. I think it's a little bit of a Don Quixote jousting at windmills efforts. I think it is designed, certainly it will fail. Joe Biden is our president-elect, and he will be confirmed in that capacity. I do think that from a state perspective, the challenges have been initiated through recounts and court challenges, and that's how we work in our Electoral College state by state. And so when it gets to Congress, it's really a limited opportunity to review the intricacies of the election process. We should have confidence in what has been done and the reviews and the recounts. And let's all recognize that while the system is not perfect, it worked state by state, and we should accept those results and move on to do some good things for our country.
So I understand you do not support that effort. Thank you for your clarification there, Governor. I want to move on to the virus. The CDC says Arkansas has only distributed a third of the vaccines that you have been given. What's the biggest challenge getting the doses into arms?
Well, there are a number of challenges, and we've got to do better, both at the federal and at the state level. One of the challenges is that we have a limited supply, and when you have a limited supply, that means you've got to prioritize and you've got to make sure you're giving it to those with the greatest needs or those with the greatest risk. And that's a challenge in and of itself. Secondly, you do have some reluctance, and that creates some complications. We're focusing on our long-term care facilities, and that has to have consents in many instances, and that slows up the process. But even with that, we have to do better. Mm-hmm. We have to act with a sense of urgency. And we can do that. We have to learn whenever you're in a battle that you have to adjust to the circumstances of that battle. And right now, we're going to have to make some adjustments in the plan to get these vaccines out.
You heard the head of Operation Warp Speed say that they were working under the assumption that there is a plan in place to immunize at the state level. Was there not a plan in Arkansas? I mean, that seems to be the implication here, that it is the governors who are dropping the ball.
No, there is a plan. And that plan has been coordinated at the federal level. But let me lay it out for you. In phase one, we're supposed to be doing our healthcare workers, and we're doing our long-term care facilities, residents, and staff. The federal government allocates that based upon where we want it to go, but they're working through the pharmacies. And they made a contract with Walgreens and with CVS, two major chain pharmacies, but the states or the local long-term care facilities can opt out. 60% of ours opted out for independent pharmacies. They're doing a better job of getting it out than the chain pharmacies. They're acting with more urgency. And so that's an example of where I've learned that whenever you look now at the challenges with a specific population, what it's going to be like when we move to essential workers and whenever we move to the general population, we're going to have to utilize more resources to get this out than we've got planned right now.
What have the other states told you is their difficulty? Is it all the same that you're laying out, the problems with the nursing homes?
Yes, it is the challenge of the work staff, the fact that we don't have enough right now for our nurses. We have to utilize our pharmacies because they have the capability and relationships to get it out. But we're going to have to look more broadly at how to utilize more resources, whether it is utilizing medical personnel that's already strained in terms of our National Guard, whether it is bringing on pharmaceutical students that can do more in terms of giving these vaccinations out. We've got to increase the capacity of our human resources.
You have the world's largest retailer headquartered in your home state. They have a massive logistics hub. Have you asked Walmart to help you out?
Walmart is ready to help.
Would it be better if the private sector took this over?
Well, the private sector is very engaged. The private sector is doing it. Both the independent pharmacies as well as the chain pharmacies. And so
but if the federal government gave directly to them versus you?
The federal government is giving directly to them. All we're doing as a state is telling it where it goes and allocate it.
Right.
The delivery is directly to the private sector, and they're getting it out, but not as fast as we would like. And so it's a partnership, and you're going to see these numbers increase dramatically in the next week, 10 days. I believe by the end of January, you'll have all of 1A vaccinated, and we'll be moving on to essential workers, if not sooner than that.
Okay, I ask you that because the head of Operation Warp Speed again said allocation came down to what the governors asked for and where they told them to send it. So it just continues to be ping pong here. So on the federal guidance, though,
no, it's saying the same thing, Margaret. It's saying the same thing. We are allocating where it goes. They deliver it to where we say, and that's to the private sector right now.
Okay. The federal government right now is telling states to prioritize people 75 years old and up along with frontline workers. There are state governors, Florida, Texas, who have moved the age qualification downwards, right, to hit more of their elderly population. Are you going to do that, or are you going to stick with what the federal government's telling you to do?
We're looking at reducing that to 70 as well. The argument that it should be allocated 75 and up first is because there's a limited supply. It might be easier for you to distribute it and know exactly who you're distributing it to. But the 70 and up population we're looking at, we're trying to save lives, getting to the most vulnerable first. And so we're still looking at that as to whether that should be lowered. That decision will be forthcoming.
So you may endorse what Governors Abbott and DeSantis are doing?
We're looking at that.
Okay.
It may happen. We're also looking at some other modifications to the recommendation of the CDC, which is simply recommendations to the governors.
Okay. Governor Hutchinson, thank you very much, and good luck to you.
Thank you, Margaret.
We'll be right back with former FDA Commissioner Dr. Scott Gottlieb. Stay with us. We want to go now to former FDA Commissioner Dr. Scott Gottlieb. He's also on the board at Pfizer, and he joins us from Westport, Connecticut. Good morning to you.
Good morning.
You said January is going to be the hardest month. I'm looking at this slower than expected rollout and this new strain of coronavirus. Does all of this come together to mean that the peak will be extended, that this is going to be painful for a longer period?
It's possible. We were hoping that we'd have more injections in people's arms at this point, and the vaccine could be starting to have an impact on the trajectory of the epidemic. And the new variant certainly creates more risk that this epidemic peak could get extended. We're going to see the epidemic probably peak at some point this month, hopefully earlier in the month. I mean, that was the original estimates and the original modeling, but the lag in terms of the effect on the healthcare system is going to be about 3 weeks. And so the healthcare system is not going to see maximal resource utilization until closer to the end of the month. And that's when we're likely to see the peak number of deaths on a daily basis as well. So we still have a ways to go with this current surge of this epidemic until we start to see cases decline, hospitalizations start to decline, and hopefully deaths start to decline. The new variant does create a lot of risk, however, that we start to see accelerated spread.
What new risks? Dr. Slaoui said that it seems the vaccines do work against it. What risks are you seeing?
Well, we're not vaccinating quickly enough to create a backstop against the spread of this new variant. Right now, there's some estimates that the new variant probably represents about 1% of all infections in this country. By March, it's going to be the majority of infections. It's going to grow quickly. And so one of the real key to controlling this new variant is to control the epidemic. That means doing the things that we've been doing, mask wearing, social distancing, but it also means getting more people vaccinated quickly. I think that the existence of this new variant that spreads more readily really creates more urgency around trying to get this vaccine out more quickly and get more people vaccinated, even if it's a more general population. There's a lot of excess demand for the vaccine right now, particularly in the elderly population. I think we ought to think about moving quickly through these phases that we've delineated and move more quickly into a general vaccination program for those 65 and above.
I thought it was interesting Governor Hutchinson sort of leaned into that concept, saying they were looking at what the governors of Florida and Texas have done with making this available to other age populations at this point. Would you ask of other governors to do that? Because Governor DeSantis was really kind of hit hard by, images of long lines of older people waiting. It didn't seem to be moving quickly in terms of vaccinations, though he widened the number of people who qualify for it.
Well, I think we can have a dual strategy here. We continue to prioritize certain hard-to-reach communities and have public health departments focus on that mission, and they're uniquely skilled to do that mission, and then make the vaccine more generally available through the retail pharmacies, through Walmart and Walgreens and CVS, to a broader population, to a general population, starting with age. We can walk it down the age continuum, make it available for 75 and above first, then 70 above, then 65 and above. There's 50 million Americans 65 and above. A large percentage of them probably want to be vaccinated. At some point, we need to allow supply to meet demand here and get the shots into the arms of the people who really want to get vaccinated and are going to go out and seek out the vaccination. If we're pushing it through the retail pharmacies, you're not going to see the long lines. They're going to have a scheduling system in place, and it's going to be a more orderly distribution. And in commensurate with that, we can have the public health departments focusing on the critical mission of going into homes, reaching harder to access communities, people who are more reluctant and need a little bit more encouragement to get vaccinated. That's someplace where the public health establishment can really focus on a discernible mission.
But explain that, because you have Operation Warp Speed saying it is working with the private sector. You had the governor of Arkansas saying they are working with the private sector. Are you saying that the private sector should just take it over at this point?
Well, look, we have 40 million vaccines that were delivered in December. 5 million were injected into arms. That's 35 million vaccines sitting on a shelf somewhere. I'm saying that we can be delivering these vaccines directly to Walmart and Walgreens, and in New Jersey, they're shipping them through ShopRite, and allow these retail establishments to start opening up more general vaccination programs for the broader public, instead of working very slowly through these preordained phases that we've articulated. Continue to accomplish that mission because it's important, but also take some of this excess supply and push it through a retail channel to the general public. If someone who's 70 years old or 65 years old wants to schedule an appointment at CVS to get a vaccination, they should be able to do that this month. So I think we should start working through the age brackets and just work our way down until we work off some of this supply. There's more vaccine coming on the market every day. We're going to have a significant backlog right now, or warehouse inventory of vaccines, and that's tragic because these could be accomplishing an important public health purpose.
Right. Well, because Operation Warp Speed is already stockpiling more than half of the supply that they have. What about vaccine hesitancy? The governor of Ohio said 60% of nursing home staff members offered the vaccine in his state, declined it. You're seeing similar hesitancy elsewhere. These are medical personnel and healthcare staff, and they're saying no.
Yeah, look, that's another reason to be making this more generally accessible. It is a reality that some people aren't going to want to get vaccinated or going to be reluctant to get vaccinated. It's going to take more work. There's about 150 million Americans who get vaccinated for flu each year. About 60 million of them are under the age of 15. So that's about 90 million people who get vaccinated for flu. I think that's your low-hanging fruit for getting COVID vaccinations out. Some high proportion of the people who get a flu vaccine are also going to get a COVID vaccine. If we just simply make this generally accessible to 65 and above this month, that's 50 million Americans, probably about 30 million of them will take it. That's your low-hanging fruit. That's the pent-up demand. We need to start working that off, because trying to push it into very discrete populations, you're going to be bumping up against people who don't want it, and it's going to create friction. It's going to create a slowdown in trying to get this vaccination out. We need to get more people vaccinated quickly and recognize that every vaccination at this point really is a public health win.
All right, Dr. Gottlieb, thank you for your analysis. And we'll be back in a moment. We turn now to Joan Jenkins. She is the CEO of the American Association of Retired Persons. You know it as AARP, and she's at their headquarters in Washington this morning. Good morning to you.
Good morning, Margaret.
December was a very deadly month during this pandemic, particularly for nursing home residents. The federal government plan is to have pharmacies like CVS and Walgreens set up clinics to vaccinate inside of these facilities. And it started in about 36 states just this past week. Is it moving fast enough?
Well, I think by every questionable that it has not moved fast enough, that, 40% of the people who have died in this country live in nursing homes. And so we see this really as an unconscionable national disaster, that 350,000 people in this country have died from COVID-19, and 40% of them have lived in nursing homes or work in nursing homes, and yet they only represent 1% of the population. So, no, we're not moving fast enough.
I didn't hear a lot of specifics from the governor or from the head of Operation Warp Speed on what they want to change. And I'm wondering from you what your view is, because we did hear earlier in the week from Operation Warp Speed saying that some nursing homes aren't vaccinating until they have enough doses for everyone in the facility. That's a federal requirement. Should the government suspend it?
Well, I think that, if you look at the data and the fact that that's where people are dying, you have to come to the conclusion that they should be doing everything that they can to be administering this vaccine as soon as possible. I know that there are 2.2 million doses that have gone out to nursing homes, and yet only 13% of that has been administered. And so we have to find a solution, and, we need to stop pointing fingers and looking at who's to blame. And really all of us, whether it's mayors or governors or the federal or governors all across this country, to really try to fix this problem.
So that's a yes, they should lift that requirement?
Absolutely, yes.
At the state level, you heard a debate about whether the age qualification should be lowered more quickly, like it has been in Texas and in Florida. Would you ask other governors to do that?
Well, I think if you look at the data of where people are dying, and if in fact we can stop people from dying of COVID, we know that that will offer some relief to the hospitals all across this country. We have examples that we're hearing from thousands of our members, particularly like those in Florida, who are standing in lines, 400 of them at 3 and 4 o'clock in the morning trying to get that vaccination. I think that we have to really solve this issue and really come together so that there is some standard for which the states and the local nursing homes know how they're going to get this vaccine and what it is they're supposed to be doing.
There's confusion. I mean, I know people who ask, where do I find out when I qualify? What do you tell your members? Do they call their doctor? Do they get an email? Who do they ask? Their local health department?
Well, I think one of the things that we've tried to do at AARP is, we have aarp.org/coronavirus, where we're listing everything that we have from the states about how the vaccine, the priorities in each of the states, how they're going to be able to get their vaccinations. Clearly, we're hearing directly from our members that they're confused about whether or not they should be calling their physician, whether or not someone's going to contact them, which of the vaccines should they be trying to take if they live in rural America or in an urban city. Just how that's going to happen. And I think that there could be some simple clarity and transparency about what is to be expected in the time frame that individuals all across this country should be thinking about. Clearly, we need to keep up the protections of wearing masks and washing our hands and doing all of those things. We shouldn't let our guard down. But there needs to be further clarity about and expectations set about when this vaccines are going to be administered widely.
Do you think that staff in nursing homes should be mandated to take the vaccine?
Well, I think that the data tells us that that's where the deaths are occurring, and that for patients and people who work in nursing homes, they need to be protected in a way. But clearly, it's not ours to mandate a vaccine.
Governors would have to mandate that, right? Is that what you're asking governors to do?
Well, I think that we're saying to the governors that this is a way to bring it under control, and that while we at AARP don't have the authority to mandate this, that this is one of the only ways that we have that we know that this particular COVID-19 disease can be brought under control.
Right, and it may come down to employers. Joan Jenkins, thank you very much for sharing what you're seeing out there. We'll be right back with a look at Tuesday's Georgia Senate race. It's an important one. Don't go away. In Georgia, a pair of runoff elections on Tuesday will decide control of the U.S. Senate and shape the agenda of the incoming Biden administration. Here's our senior national correspondent, Mark Strassman.
Republicans have a New Year's resolution: keep Georgia red as its clay.
We have to hold the line here against socialism. We need y'all to get out and vote.
In dual runoffs here, if Republican Senators Kelly Loeffler and David Perdue both lose, Democrats will seize control of the Senate. It would be a 50-50 split, with Vice President-elect Kamala Harris breaking any tie vote.
The whole country is watching Georgia voters to see what we will do at this historic moment.
Democrats Joan Ossoff and Raphael Warnock each have raised more than $100 million over the last 2 months. Their blitzkrieg of ads call both Republicans corrupt.
Looting Loeffler and Chicken Perdue.
You can either help Kelly Loeffler to help herself, or you can help me to help you.
More than 3 million Georgians have already voted, some in lines almost 4 hours long. The wild card? President Trump's groundless griping about election fraud here and its impact on Republican turnout this Tuesday.
I don't believe you lost Georgia. No, I don't.
Over the weekend, the president tweeted Georgia's runoffs were illegal and invalid. Billboards urged resentful Republican voters to stay home in a moment when state and national GOP leaders need those voters to turn out.
My family, my nation, our way of life depends upon you.
President Trump will hold a runoff rally in North Georgia tomorrow. But many Republicans here worry it could do more harm than good. In dueling last-minute rallies, President Trump and President-elect Biden will both campaign in Georgia tomorrow. Senator David Perdue will likely miss his stage time with Mr. Trump. Perdue is quarantining after being exposed to a staffer with COVID. So far, he's tested negative. Margaret?
Mark, thanks. And as our new senior national correspondent, Mark will continue to report regularly for us here at Face the Nation. That's it for us today. Thank you for watching. Until next week, I'm Margaret Brennan.